Sorry, Prof. Can you start over?
Okay. Okay, I'm not exactly sure what happened there, but I lost control of the system. All right. We're taking a refresher of what we covered last week. And we said we covered simple sampling techniques last week. And today we're going to focus on complex sampling. And so my question was, who remembers the similarity between simple random and systematic? What do the two of them have in common?
Emmanuel?
Okay, good evening, Prof. Good evening, everyone. So, simple random sampling and then systematic sampling are probabilistic sampling techniques. And both sampling techniques give an equal and non chances of being selected.
Okay, excellent. So the point is that they both result in an equal selection probability for everybody involved. What's the difference between the two of them? Because we need to understand these basics, like in and out. This should be like part of our foundational knowledge if we're really going to understand sampling.
Okay.
Okay. So the difference between the two of them for simple random sampling, just like the name, is just about taking a random sample of the entire sampling frame or the population. And then for systematic random sampling, it has to do with an ordered and a systematic way of making the selection.
Excellent. I think there's another hand up. Somebody wants to provide another perspective.
Faraja?
Hello, Prof. Can you hear me?
Yes, we can hear you. Go ahead.
Hello, Prof.
Yeah, we can hear you.
The difference is for the systematic sampling is that we have to do with the sorting variable. All these are probabilistic sampling techniques, but the difference for the simple random sampling and systematic sampling is that for the systematic one, we need to have a variable through which we're gonna sort all the data. We will have to deal with the probabilistic sampling, but we need to have a variable that is gonna help us to sort the data before we go through analysis. The sorting variable is the key for systematic sampling.
Excellent. So remember we said also that if you go into a hospital and you decided to take every fifth bed, like every fifth patient in that hospital, well, you are implicitly sorting on the arrangement of patients, even though you have not literally sorted, but there's always something you're sorting by, whether you acknowledge that or not. So that's the key there. And remember, we also said that systematic sampling can be random or non-random, depending on what makes systematic sampling either random or non-random.
I'm going to look for yes, sir. Yes, sir.
So good evening.
That...
I think that is the process of choosing the first on the list. If it is chosen randomly, then it's random. Otherwise, it's not random.
Excellent. Very good. So that means you guys were paying attention. So yes, So today, like I said, we're going to focus on complex sampling. Now, when we say complex surveys, if you check on PubMed for the words complex survey, I'm sure you're going to get over 1 million hits. What does that mean? When you hear the word complex surveys, what comes to mind? And how is that different from simple surveys? What makes it complex? We need to understand that before we dive into it. So what are complex surveys?
Jocelyn?
I think when you say complex survey, it needs more than unlike that of simple and random sampling. Plus, there may not be sorting. There may not be sorting.
Okay, thank you. Any other perspective? Okay, let's put it this way. For a survey to be complex, it must involve either blank or blank. One of those two entities must be involved for us to call it a complex survey. What are those two entities I'm looking for? Complex surveys in general will involve either use of blank or blank. Any thoughts?
No hands yet, but they say it may include strata and inconvenience sampling.
Okay, it may involve strata or what? What's strata's younger brother or older brother? Whatever however you want to look at it. So it involves either strata or what?
Clusters.
Excellent. So once you have something that involves either clusters or strata, we call it complex survey. And in this case, it is complex because the unit of selection is not necessarily the same as a unit of analysis. That's why it's complex. It's not complex that not that it's hard to analyze, or not that your research is extraordinary. It simply means that the unit of selection is not the same thing as the unit of analysis. You see, when we do a simple random sampling or systematic sampling, in general, the unit of sampling is the same as the unit of analysis. In other words, we are selecting individuals and we're analyzing individuals. But with complex surveys, we are selecting a unit of selection that is not necessarily the individual, and that's why it's complex. So the session for today and for next week will focus on complex surveys because, well, in the real world, that's what you're going to be designing. So today we'll set the principles for complex surveys. And then next week, what we'll do is we'll go into a case study that allows us to apply what we just covered in this session. So that's how we're going to go. So at the end of this class, I'm going to give you homework. The homework will be to review the documentation for one of our complex surveys that we've conducted in the US, the National Youth Tobacco Survey. So you're going to read the methodology report, and then next week we're going to discuss it in detail so that we can have a firmer understanding of how complex surveys work. So today I'll just set the principles at high level so we can understand. All right, so let's talk about surveillance systems. What is the distinction between a survey versus a surveillance system? Well, in general, when we talk about cross-sectional surveys, we mean that data collection occurs at a single point in time. So you have time one, and we collect data on individuals who were sampled. But when you hear of a surveillance system, you want to think of data collection that is occurring over different points in time. So surveillance systems, whenever you hear the word surveillance, it should trigger the idea that there is continuity in data collection. So we're not necessarily interested in collecting data at one point in time, but it is a repeated system of data collection. Now, within surveillance systems, we also want to distinguish between two different types of data collections. The first is repeated surveys. Repeated surveys means that we come to this group of people in the population. Let's say we're doing a survey in, let's say, Ghana. We draw a random sample of adults in Ghana in time 1. Next year we draw another random sample. Now, some individuals in the second sample may have been the first sample, but the goal is not necessarily to follow the same individuals from time 1 on to time 2, right? The goal is to capture the population and follow the population over time, not necessarily individuals. So our interest is in capturing the population and how the population changes over time, and not necessarily individuals within the population. So we'll come to time 1, we draw a random sample of the population at time 1. Come at time 2, we draw another random sample. It's possible that some guys in time 1 may also be included in time 2. That's possible. But the interest is not necessarily in tracking individuals from time 1 to time 2. That's what we call repeated surveys. They sound the same, but they're very different. Then secondly, we have longitudinal surveys. Longitudinal surveys are studies in which we are tracking the same individuals over different points in time, right? So individuals at time 1 are followed over time, and then we, see what happens to them at time 2. The same thing with individuals, other individuals who were assessed at time 1. So that's the distinction between repeated surveys versus longitudinal surveys. They sound similar, but they're distinct. One is focused at the population overall. The other is focused on individuals within the population. Sorry, hold on a minute. Let me quickly just a sec, please. There's so much interference in today's meetings. All right. Right, continuing the presentation. All right, so now let's talk about the process of designing a surveillance system. If you're an epidemiologist or a data scientist, at some point in your career, you might be responsible to design a surveillance system. And so there are some things that you need to consider as minimum requirements for designing a surveillance system. And it's not just the science. Designing a surveillance system requires a lot of thought about people and processes and politics and money. I'm sure we're all aware of what's happening in the US now, where we have, whole agencies being cut off, and that's the death of the surveillance system. That's a reminder to us that when designing surveillance systems, you also have to worry about stakeholders, right? Very importantly, stakeholders are very important. And it's not just about the science, you have to worry about the politics as well. There's no such thing as a free lunch. Everything requires money. So who is going to pay for this surveillance system? Who is going to pay for it in year 1, and who is going to pay for it in year 2? Are we going to alternate funding from one agency to the other? Or is there a pot of money somewhere that will fund it forever and ever? Those are practical questions that you need to think about. It's not just about saying, oh, what's the sample size and what's the response rate? No, science is important, but also it's politics. So you have to worry about issues of governance and politics and stakeholders. All of those things are extremely important when we're designing surveillance systems. In federal surveillance, which is, the majority of where I've done a lot of work, we think of, partners at the state level, at the federal level. We think of partners in academia and many other agencies. In your own context as well, you must think of stakeholders. Stakeholders might include the people you're collecting data from. You might have community leaders and, elder statespeople who you need to engage to ensure you have good response rate. You might have funders, you might have, international partners. All of these are stakeholders that you might obviously need to get their buy-in. When describing a surveillance system, we need to talk about who, what, where, when, and why. Those are standard descriptions that we use to capture or describe surveillance systems. For example, the National Adult Tobacco Survey, we can describe the who as non-institutionalized adults aged 18 years or older. The what describes, the methodology used to capture the individuals or the mode of data collection. You also have to describe where data collection is occurring. In this case, the 50 US states and the District of Columbia. When, of course, each surveillance system has to answer questions of person, place, and time. So you have to describe the when for each wave as might be appropriate. And of course, the why. You don't just wake up and design a surveillance system. There is always a reason why it was designed. And so you always have to provide a reason for why the surveillance system was put into place. Now, when you also design a surveillance system, you need to think of your outcomes. We also call them indicators or outcome indicators. And typically we put them into buckets. We talk about short-term outcomes, intermediate outcomes, and long-term outcomes. So you need to define all of them. And the reason why you need to think about all of them is because you need to factor which one might be used to calculate sample size. And of course, which ones you also have to share with stakeholders. Stakeholders are obviously interested in what you're capturing. How does your surveillance system improve their lives? It should never be the case that the only reason why you want to collect data is to advance your own career and publish manuscripts. You also have to worry about the stakeholders, what's in it for them. And so this is where you can show that the surveillance system has merit to your audience. You can say, oh, we're collecting this data so that we can look at, the degree of compliance with smoke-free laws and know where we need to improve. Or we are collecting this data so that we can look at how we can improve interventions that will reduce tobacco use, for example. So it's very important to focus on your key outcome indicators. Then you have to worry about the science. So again, it's not only about the science, but of course, the science is a very key part of this. Now, when we talk about the science include not just p-values, but also issues of design. I think one of the flaws in graduate school training is that we don't talk enough about design. We focus so much about results and outcomes, but not enough about the design that give rise to those results. Design is an art, of course, but also a science. And so from the perspective of both a science and an art, these are some of the things we need to worry about, right? We need to worry about simplicity. Simplicity means that it should not be too complicated. Imagine you have an outcome that requires collecting blood samples and collecting a whole bunch of other biomarkers and sending them to a lab that is 1,000 miles away. That is not a simple surveillance system. It's pretty complex. So the surveillance system should be simple. It should be flexible. Flexibility simply means that your surveillance system can adapt to changes in information need. So today we might need data on why or the impact of tariffs on the economy, right? Your surveillance system should be nimble enough to say, okay, we can quickly add questions to that surveillance system. In federal surveillance systems, the trick we usually do is that we have two sets of questions. We have core questions, which don't change, and then we have rotating questions, which change. So the core questions are fixed, and that is to allow us to be able to measure trends over time in some of the most important outcomes we care about. But then we also have rotating outcomes, and we need to rotate them because you can't have a questionnaire that is 1,000 questions long. We need to rotate them out. And so this allows us to have flexibility in our surveillance while also ensuring stability, because those two things are two sides of the same coin. They are opposites. Flexibility means that it can change. Stability means it does not change. You can see that they're opposites of each other. So a stable surveillance system means that it does not change in either the outcomes or the methodology. So you can think of, for example, the US, now that you've had entire agencies cut off. Well, when you bring in new people, they will design the surveillance system a different way. Why? Because survey design is both a science and an art. So from now henceforth, you will expect that there will be drastic changes in expected prevalence of health outcomes in existing US surveillance systems because you've had a disruption in how the methodologies were carried out. So in that case, you can say that those surveillance systems are not stable because they're changing in terms of how things are measured or who is measuring it or the methodology. Because even small changes in methodology can result in changes in expected prevalence. So that is how we think of flexibility and stability. We also have to worry about data quality. How do we clean data? How do we prevent bad data from occurring? And things of that nature. Acceptability is very important because you're working with stakeholders. Whatever thing you're doing has to be culturally acceptable to them. So, so that you can get their buy-in. Predictive value positive, sensitivity are also very important in terms of the accuracy of a surveillance system. Representativeness is important from a scientific perspective because that has to do with external validity. So how do we ensure that we sample in a way that is representative? And this is where the sampling techniques come in. Are we going to use simple random sample? Are we going to use systematic? Are we going to use cluster sampling? Those are decisions that we have to make in terms of the representativeness. And then timeliness, that's very important because one of the setbacks of public health is that we collect data and 5 years later, that's when we're releasing that data. That's not good enough. We need to improve. And we tried so many things. We tried so many methodologies in the past to see how we could improve the timeliness of some of our national surveillance systems. We've tried mobile phones, and we've tried a whole lot of other experimental technology. But it's one of the problems we always face with large surveillance systems. There's always a time lag between when we collect the data and when the data is released, such that the data of the time they're released are not necessarily capturing that point in time. It's like the data are very late. And so that's one of the challenges we have to worry. But your responsibility is to make sure that you reduce that time lag to as little as possible so that the snapshot you've captured represents the current moment. You don't want the snapshot trailing behind the current reality because it questions the usefulness of your data as of this time. So remember we said that the surveillance system is a bunch of surveys that are either longitudinal or repeated. So let's zoom in on one single survey and see how do we consider issues of simplicity and representativeness and all those other indicators when we're designing surveillance systems. So the key questions you must answer when designing a surveillance system. One, what are my intentions, right? And it doesn't matter whether it's your surveillance system or you've been hired to design a surveillance system. You might be deployed to a country where they say, oh, you want to help this country design a national survey. Or you might be designing a national survey for yourself. The first thing you want to figure out is what is the intentions as far as the data, how will the data be used? Is there intention to create generalizable knowledge? We covered part of this last week, but this is just to emphasize because this is extremely important. If there is intention to create generalizable knowledge, then it means that we must use probability-based sampling techniques. We also have to worry about the budget. We discussed this extensively last week because that's also obviously very important. When we decide that our sampling will be generalizable, we have to worry about issues of non-coverage bias. We're going to bench this and talk about it a lot next week, right? When we look at the case study from the National Youth Tobacco Survey, we're going to see practically how issues of non-coverage bias can creep into the study with or without our knowledge, how we can assess for it, and how we can correct it with language, with framing, right? So these are some of the things we're going to discuss next week. So just putting it so that raises our collective consciousness of some of the issues we need to watch out for. So we obviously need to be practical and nimble when we're designing surveillance system. Sometimes the population you want may not necessarily be the population you are able to get. This is just an example. In 2017, I believe, CDC and NIH wanted to do a collective study of dentists, a national survey of dental providers, not just dentists, in the US and Canada. Well, the problem is that we did not have a sampling frame for all of those individuals. So what did we choose to do? Well, we decided to instead do a national survey or international survey of faculty in dental and dental allied programs. So dental schools, dental hygiene schools, dental assistant schools in the US and Canada. Why? Well, because with those ones, it's easier for us to access their information. All schools have the directory of faculty and staff on their websites. So it's easier for us to go and access that information and use them to create our sampling frame. So the idea here is that sometimes when the desirable is not available, the available has to be desirable. So in that case, we have to figure out, this is the population we really, really want, but we can't access that population. How can we be practical and nimble so that we can get what we want? So this is just describing that sampling frame, that context. When we discuss next week, we're going to focus more on this in practical ways to show how that applies in the real world. Now, let's now dive into the design of cross-sectional studies or complex surveys. So we are all familiar with the PICO framework, which we use a lot in clinical trials or clinical studies in general. So the PICO framework, as we know it, represents the key elements that we need to pay attention to when we are designing studies, especially analytical studies or comparative studies. So P is population, I is intervention, C is comparison, and O is outcome. Now, when we're designing complex surveys, we also have our own PICO that we have to worry about. So I came up with this model just to help with intuitive understanding of how we design complex surveys. So when you're thinking of clinical studies, think of this PICO on the left-hand side. When you're thinking of complex surveys, think of the PICO on the right-hand side. So the PICO on the right-hand side has the P and the O is the same. What changes is the I and the C. The I is independent strata, and the C is clusters, right? So when you're designing a complex survey, so the four things you have to worry about: the population, the independent strata, clusters, and the outcome. We're going to dive into this and see how they tie together. So let's talk about the first letter, which is the P, population. The population here, in this case, represents the target population, right? And our goal is to fetch a sample of this population in a way that we can make inferences from the sample back to the population. And remember, this is what we call the cycle of inference. The cycle of inference means that we have a population here. From a population, we take a sample through the process of sampling. And this is what we're talking about. Sampling can exist in different types: simple, random, systematic, clusters, and many others. And if this sample was drawn at random, if the sampling method was at random, then that means that we can make inferences from the sample back to the population. And that's what gives us the cycle of inference. Now, strata. Strata are very important. But one of the things you must realize is that stratification is a luxury, not a requirement in surveys, right? And this is something you always have to manage very clearly. You always have to, when you're working with clients, especially if you're designing surveys for whether they're clients in industry or government, entire government agencies. Oh, they always want a lot of things. They want you to stratify by age and race and income, and it's your job to manage the expectations and tell them, we would love to stratify by all of those things, but it's not practical, right? We have to be very selective in what we stratify. So you can have a survey that doesn't have stratification. Stratification is not a requirement, right? Think of it as a luxury. I've in this slide here, I've compared it to DEI. DEI is a very controversial word nowadays. Diversity, equity, and inclusion. That's exactly what strata do. They exist to ensure DEI, that there is diversity, equity, and inclusion in our sample. So we stratify not to improve validity, but to ensure representation. That is all what stratification does. It ensures that our sample is diverse and captures the entire spectrum, right? So stratification has no impact on validity. I cannot emphasize that enough. We're not stratifying just to improve validity. We're stratifying to ensure that we have precision and we have representation. So think of it as the DEI of study design or of survey design. So that's why we stratify. So the moral of the story is that you don't have to stratify when you're designing a complex survey. It is a luxury, not a requirement. We'll see more of that when we look at the case study for next week. So what does that happen? When we stratify, what is happening behind the scene? Well, here we have one large population here on the left-hand side, This is a case where we do not have stratification. When we stratify, what we're doing is that we are splitting that population into the two different strata. So in this case, we have the red stratum and the blue stratum. Then once we stratify, we must sample from each stratum. So here we divided these individuals into two groups, the red and the blue, and then we have to sample from the red, and then we have to sample from the blue, right? That's what happens in stratification. We divide the population into mutually exclusive groups. What that means is that an individual can only belong in one stratum. And then once we've done that, we can then sample from each strata. The beautiful thing about stratification is that it allows us utmost flexibility. It means that once you stratify, you can do whatever you want with this strata. You can think of a strata as completely different populations. I can use a completely different sampling method here and a completely different one here. But the rule is that if you stratify, you must sample from each one. Imagine you stratified here, and then you sampled only the guys in blue and omitted the guys in red. That's a case of non-coverage bias because you fail to sample from one of the strata. That's a no-no. So moral of the story, you don't have to stratify. You should not stratify on too many variables. And if you split the population into strata, you must sample from each strata. So the primary reasons why we stratify are to allow, like I said, DEI, diversity, equity, and inclusion, to allow representation among individuals from small samples or small subgroups so that they are captured or represented in our sample. As we explained earlier, the way we stratify is we divide the population into strata. One individual can only belong in one stratum. And then we can then sample from each of the different strata. All right, so we've talked about the P and I of PICO, the population and the independent strata. Now let's talk about the clusters. So remember that we said last week that for us to do a random sampling, we must have a list. There must be a list. Ideally, we can have a list of all the individuals that exist in that population, in which case we can do simple random sampling or systematic sampling. But sometimes we don't have a list of all the people who live in that country or that location. So the next question is, where do we find these individuals? Well, in that case, we can create a list of all the places where the people can be found. So it's either you have a list of the people or you have a list of the places where the people can be found. Remember, we said that where the desirable is not available, the available must be desirable. What is desirable is a list of all the people. If we don't have that list, well, the next thing is, do we have a list of all the places where people can be found? Now the question is, where can people be found? Well, it depends on what they're doing. If they're students, we expect to find them in schools. If they are workers, we expect to find them in workplaces. If they are just adults or older population, we expect to find them at homes or in nursing homes. So all of those places can be clusters. So essentially, clusters can be anywhere that people can be found in groups. So, and we use clusters because we don't have a list of all the people who live in the population of interest. The cluster should be as close to the ground as possible. What does that mean? It means that if we're trying to do a survey of, let's say, the United States, it will make no sense to say, I want to use the 50 US states as clusters. Because remember, ideally, what we were aiming to get was a list of all the individuals. And so from the individual, you can think of, oh, the individuals live in a street. The street is located in a census tract. The census tract is located in a county. The county is located in a state. So by using a state, we have strayed so far from what we wanted originally. What we wanted was the individuals. So you want to choose a cluster or a cluster definition that is as close to the ground as possible. So in this case, I can use a census tract as my cluster. I can use a county, but to move all the way and use an entire state, oh, that's too far from the ground, right? So we want to use clusters that are very close to the ground as possible. Now, what's the minimum number of clusters that you need in your survey? Well, the answer is 8. If you do not have up to 8 clusters, that does not meet the precision rules by the National Center for Health Statistics, right? So if you, let's say you're doing a survey in and this is a problem when you end up using states as clusters. Imagine you want to do a survey of, let's say, states or survey of adults in the northern part of the country, and you chose to use states as clusters. You might end up selecting only 5 states. Well, 5 states means you don't have up to 8 clusters, right? So always think of how do we get as close to the ground as possible. And so the minimum number of clusters you want to get is 8. This is a flow chart by NCHS in the guidelines for precision of studies or surveys. This is a very, very important guideline. We're going to share the link with you, but it sets forward the standards that we expect to follow when we're designing, or analyzing data from national surveys. But bottom line is that you need to have the degrees of freedom in your survey should be at least 8. This is not very clear here, but this is the point where we're referring to, right? The degrees of freedom is simply equal to the number of clusters minus the number of strata, right? And that's where we get this number from. And so you should strive to ensure that you have at least 8. Now, don't go and exactly select 8. Aim for larger. The more number of clusters you have, the greater the precision of your estimates. And so you should aim for something between, 15 is a good number, right? If you can, and that allows for your estimates to be very precise. Now, we cannot talk about clusters without talking about the problems with clusters. The problem with clusters is that the apple does not fall far from a tree, which means that people who are from the same cluster tend to look alike. They behave alike. After all, that's from the same cluster. Now, that's a problem for us because we want our survey to be very, representative of population. We don't want clustering where individuals just tend to be alike, in many, many ways, because that doesn't really give us a true flavor of the diversity of a population. Think of it this way. Imagine that we have a sample that is so clustered that every second individual gives us an identical answer as the first guy before them. So if we needed to sample 50 people, or if we needed to sample 100 people, just because every second guy is given an exact answer as the first guy before him, what we now have are not 100 unique answers. What we have are just 50 unique answers because of that cloning effect, right? And so that's the problem that clusters represent. Clusters give rise to a scenario where answers are like clones of each other. Of course, they're not identical clones, but individuals who belong in the same cluster behave alike, and that is a problem which we need to correct. So in our survey, for example, if every second guy is giving us an answer that is identical to the guy before him, and we sampled 100 people, it means that we don't have 100 unique answers, but 50. So that means that if we truly cared about having 100 unique answers, we need to sample not 100 people, but 200, right? That's how we correct for this issue of clustering. And so when we're designing complex surveys, there is the parameter we need to be aware of, or the indicator we need to be aware of, called the design effect. The design effect simply means that it simply acknowledges the fact that people in the same cluster are similar, and that we need to punish the clusters for being so similar. And the way we punish the clusters is by increasing the sample size so that we get the number of unique answers that we so desire. So that is something we need to be aware of, and that we will account for when we're calculating sample size for complex surveys. Again, this is just a reminder. We covered this slide last week, but this is to refresh our minds and summarize what we've covered so far. So the very first question you want to ask at the beginning of your sampling is, does a complete, correct, and current sampling frame exist? Or can I create one? If the answer is yes, well, you can do simple random sampling, you can do systematic sampling, you can do a census of everybody. If the answer is no, well, you have no choice but use cluster sampling. So remember we said stratification is a luxury. Well, cluster sampling is not a luxury. It is a requirement. When you have a scenario that you don't have a sampling frame, but you still need to generate a representative sample of that population. In that case, the only option you have at that point is use cluster sampling. So while stratification or use of strata is a luxury, use of clusters is not a luxury in a case where we have a lack of sampling frame, where a sampling frame does not exist. So this is why cluster sampling is so important in survey epidemiology. Again, this is a way to remember the difference between clusters and strata. Think of strata, think of same. Strata and same start with the letter S. Think of cluster, think of contrast. So in other words, we're saying that you have two groups here, the left and the right, right? Which ones are strata? Is it the left? What is this one here? Are these clusters or are these strata? Who can help us out?
Discipline?
I think the left side is the strata because it is internally homogeneous.
Excellent.
And
so these are
externally
strata.
heterogeneous.
So,
Whereas
and then okay,
the right
yes.
side is the clusters, which is internally the heterogeneous, whereas the external one, it is homogeneous.
Excellent. So that's the idea. So the idea behind clusters is that, well, this cluster looks like this cluster, which looks like this cluster, which looks like this cluster. So from a perspective of efficiency, it's like, do we really need to sample all of them? Do we need to collect data from all of them if they all look alike? Well, the answer is no, we don't. So then how about we just sample some of them? Maybe instead of selecting all 4 of them, we can select 2 of them. That's the idea behind clusters, that clusters are like one to the other. And so we don't have to select all of them. We can just select a sample of them, and that should give us an idea about the whole population, at least in theory. All right. And then strata here means that we've divided the population into groups where all the individuals in a group look alike. So you can imagine what will happen if we decided to select only the black and the white group, and we left the blue and the yellow group. Obviously, the results are not generalizable to everybody because we now have a problem of non-coverage bias. The people in the blue and people in yellow are not covered. So that's why once you divide the population into strata, you must sample from every single stratum, or otherwise you have a problem with non-coverage bias. All right, let's look at ethical considerations. Obviously, you have to consider issues of consent and issues of data residency and this data security and incentives. We won't worry too much about that now because the focus of our session now is on sampling. When we collect data, unfortunately, life doesn't go according to how we planned it to be. We may have planned for our sample to be representative, and we may have done our very best to ensure that, but sometimes, things don't happen that way. So you end up with a scenario where the sample no longer represents the population. You need to be able to make sure that you have indicators to assess data quality. Next week as well, we're going to talk about issues of how to ensure or how to measure to assess whether our sample is representative. But suffice it to say for now that as we're collecting data, we want to make sure that we've collected indicators of data quality to ensure that the data can be assessed to see whether they're fit for use and fit for purpose. That includes checking for duplicates, checking for missingness, for skipping, ineligible patterns, and so many others. Post-data collection, we have to also decide whether to weight or not to weight data. Those are some of the things we're also going to cover next week in our case study, but just to put that on our consciousness. This is what weighting does. We're going to cover it next week, but just to give you a visual idea of what it does. This is our sample, which is the data we have just collected. Now, the data is supposed to resemble the population, which is this jar or this vase here. Well, you can see there's nothing that connects even remotely resembles this vase from what we've collected here. The sample does not look like the population. What weighting does is it forces the sample to adopt characteristics or to look like the population, right? So that's what we do. That's what weighting does. Next week's session, we're going to do a case of weighting so we can see what that looks like. But today, again, we're focusing on clusters, mentioning these things ahead of time so that we can, next week, we'll have a better recall of how all of these things fit together. But for now, what I want us to focus on is that we do cluster sampling because we don't have a complete sampling frame, or we don't have a sampling frame period, right? And we will have loved the list of all the people, but since we don't have that list, our next question is, do we have a list of all the places where people live, which could be schools or workplaces, right? That's the idea behind cluster sampling. The second important thing to note is that cluster sampling is not a luxury. Unlike stratification, stratification is a DEI exercise, right? We want to increase the diversity or the representativeness of our sample. But cluster sampling is something we have no choice but to do when we don't have a sampling frame. That is very important. And so we're going to bench all of these things and look at them hands-on. But for now, what I want us to do is to look at a practical example of how we do cluster sampling. I also want to see how we can calculate sample size and account for all of those things we discussed so that it ties everything together. So our case study now includes two elements. How do we calculate sample size and account for all of those things we discussed, like design effects and strata and clusters? And then number two, how do we sample when we're using clusters in a way that is representative? So that's what I want to do now. And then we're going to take questions and then proceed from there. So I'm going to go over to the Chisquares platform to do all of those. But first things first, this is the case study for next week. I'm going to drop the link in the chat so you can read it. So the goal for you is to read this very thoroughly. This represents the level of complexity you'll expect in the real world. And so next week, we're going to dissect the methodology in a way that makes sense to all of us so that we can put the missing parts together in a way that is coherent. So, so please, before the class next week, try and read this. It's a bit lengthy. I think it's about well, not too long. It's about just 40 pages. So it's a bit of a technical read, but please try and read it before the class next week and try and understand it to the extent possible. So you have questions that you can present in class. All right. This is the link from which the questionnaire came from or the report came from. So let me drop that here as well. You might want to pull the data set and look at weights. This is the data set here. So 2019 NYTS, this is the methodology report that I just shared. You might also want to download the data set and codebook and look at weights, right? I would like you to pay attention to three variables in the data set: the weight variable, the PSU variable, and the stratum variable, right? Remember, we talked about three things today. We talked about clusters, we talked about strata. Remember, those two things will finally appear in your data set. The clusters will appear in your data set as PSUs. The strata will appear in your data set as strata, right? And then the selection will appear in your data set as weights. We need to be able to map all of those things together and understand how do they come out from the design, how do they manage to enter our data set? We need to understand all of those things. So please, let me drop the link to this as well. So this is the website here. And so we are using year 2019 you can download the methodology report from here, and the data set can be accessed from here. Some folks say they can't access the file. I'm not sure what the issue is, but anyway, just if you cannot access it, just Google CDC National Youth Tobacco Survey, and you can then access the file from there. All right. So let's go ahead and look at the issues we talked about. So there are two things we want to address. How do we calculate sample size for a complex survey, bearing in mind that we have to account for the complex design, like the strata and the design effects and the stratification. And then number two, how do we sample when we're using clusters? Remember we said last week that when we use clusters, it's possible that our clusters could result in a self-weighting where everybody has the same probability of selection, or could result in a sample where everybody has differential selection probabilities. We'll just quickly do a demo of that to see at least the first simple case where everyone has the same probability of selection. All right, let's go to sample size first of all. So to calculate sample size for your complex survey, we'll come here and select new sample size. And here we're going to select cross-sectional study with percentage as outcome. So in a large survey, complex survey, you're likely going to have many, many, many outcomes, hundreds, if not thousands of outcomes. However, only one of those outcomes can serve as the benchmark for sample size calculation. So it doesn't matter whether you have 1 million variables, only one of them will be used to calculate sample size. So you want to select that variable very carefully. So when we are saying prevalence of outcome, you might ask, oh, but I have 100 outcomes. No, we're referring to that one outcome you have to select to serve as the representative of all your variables. All right, so let's look at that. So when you don't know what the prevalence of the outcome is, you just put 50%. And what is special about 50%, you might ask? Well, you should make it a habit to read the hints here. We've tried to provide the educational hints that explain the context so that you can understand. So it's not just about you entering some random numbers into an app and getting a number. It's important to understand the context as well. So here, for example, it tells you that binary outcomes such as yes or no exhibit maximum variance when the probability of either outcome is equal. So what that means in simple language is that you are going to get the maximum variance when you have 50-50 on each side. Think of when we say a country is highly polarized. If we say, for example, the US is highly polarized, it means that 50% of the population agree on something and the other 50% disagree on that same thing. That is the maximum polarity that a country can ever have. If 90% agree on an issue and 10% disagree, well, the country is not polarized. It means the majority agree, So the maximum polarity, or in this case, in statistical terms, variance, is when you have 50-50. And that's important because that's when you're going to get the maximum sample size. And that's important because remember we said that you might have hundreds or thousands of outcomes. The last thing you want to do is use a sample size that covers some needs, but not all needs. So when we're not sure, or when we have many outcomes, it's best for us to generate a sample size that is the maximum that we could get. So it's better to be safe than to be sorry. So if we don't know what the outcome is, we put 50%. That's the basis for putting 50%. Now, population size. Sample size is agnostic of population size. So what that means is that, remember we said sample size calculation is like tasting a pot of, tasting soup that you're cooking, right? If you're cooking a big pot of soup, you might take a very small tablespoon and take a scoop from that larger pot. Now, the amount of soup that you need to taste does not necessarily depend on the size of the pot, right? It doesn't matter whether the pot is this big or that big. For practical purposes, the amount you need to taste whether the soup is well seasoned or not, is really small. It is independent of the size of the pot that is being cooked. The same thing applies sample size. Sample size, which is the scoop we're taking, is independent of the size of a population, right? Which is something that people get confused about all the time. And I can imagine why it might be a bit confusing, because what we're saying is that it doesn't matter whether the sample size is for all of Africa or all of the United States or for your village, or well, assuming your village is large enough, right? Or a state, the sample size remains the same. So bottom line here is that don't get into a frenzy saying, oh, but I don't know what the population size is. Like you can put any large number here. You can leave it at 1 million. It's completely fine because the population size does not affect sample size. However, the only time the population size will affect sample size is when the population size is very small, right? Then it becomes a problem because the assumption when we take samples is that the sample is infinitesimally smaller than the population. But if the population is so small that that assumption is no longer met, then we need to correct for it. And that's where we talk about the finite population correction. Not to bore you with the details, but bottom line is that if your population is fairly large, you don't have to worry about the sample size of the population size. You can just leave it at 1 million or so, and that's fine. Now, will cluster sampling be performed? Of course, if it's a complex survey, the answer is yes. If it's a simple random survey, you don't have to, the answer is no, obviously. But here we're dealing with complex surveys, so we're going to say yes. Now, the next thing is for us to do is provide a design effect. If you remember, we said the design effect is a punishing factor. We're trying to punish the clusters for being so similar. Remember, we said the apple doesn't fall far from a tree. So people who are in the same cluster tend to look alike. And that's a problem for us because we don't get answers that are diverse because they are just clones of each other. So we need to increase the sample size so that we get the diversity that we would have gotten had we used a simple random sample. You see, everything we do in survey design ends up being compared to a simple random sample. So we're saying that, oh, we'll have loved the diversity of opinions that we get in a simple random survey. But for efficiency, we're going to use a cluster sample. However, we're going to use the design effect to adjust so that we get that same amount of diversity in opinions that we would have gotten had we used a simple random survey. So in a simple random survey, the design effect is 1. That means that if we're using cluster sampling and we have to punish the cluster, that means the design effect has to be more than 1. Typically, we use values between 1.5 and 4. So you can have your sample size table where you try different values and see which one eventually corresponds to your budget. Because at the end of the day, if the sample size says you need 1 million people, but you have a budget for only 10,000, it doesn't really help you. Sample size calculation at the end of the day is a guesswork. It's a scientific guesswork. So we're just trying to optimize to get the closest that we can. So we can put a value of 1.5 for the design effect here. Next, we have number of strata. We're counting for number of strata now. The number of strata exponentially increases the sample size. So if we have 2 strata, that means our sample size will be doubled. If we have 4 strata, that means our sample size will be quadrupled compared to if we had only 1 stratum, or that is the entire population was just one large population or no strata. So here, let's assume that we have 2 strata. The margin of error we provide here as 5. Margin of error is simply telling us how wide do we want our confidence intervals to be. So the margin of error is essentially half the width of the confidence interval. So if our confidence interval ranges from 5 to 15, that means that the width is 15 minus 5, which is 10. Half of that width is 10 divided by 2, which is 5. So the margin of error is simply telling you how wide do you want your confidence interval to be. If we put our margin of error as 20, that means that we are saying that we want to accept that our confidence interval will be 40 percentage points wide. Now, that is not good Why? Well, because we have to go back to NCHS guidelines. NCHS guidelines are very clear on what is acceptable width of confidence intervals, right? So please, again, read it. It's very good if you read through this NCHS guidelines, because they provide a technical basis to understand why we put a lot of validations in place. So NCHS guideline says, well, we want to make sure that the width of a confidence interval is not more than 30%, right? So obviously, a margin of error of 20% is not acceptable, because that means that your confidence interval will be 40 percentage points wide, which goes beyond what is allowed per NCHS guidelines, right? Ideally, you should use margin of error of 5. That ensures that you have nice, tight confidence intervals, and in other words, your results are precise. And then the response rate. The response rate will obviously depend on the mode of survey collection. You know, if you're doing a web survey, you would most likely expect a low response rate. If you get a response rate of 30% for a web survey, well, that is a really fantastic response rate, right? People don't answer emails. Things go to spam and all of that. In face-to-face surveys, response rates are obviously higher, typically 50 to 60%. So this is contextual. So let's say we hope to achieve a response rate of 50% because we're providing incentives, right? And so we provide all of those things, and then we click on get results. The platform then calculates the sample size and tells us that, okay, we need 2,305 people for our study, and this is the formula. Take note that this formula gives you the nominal sample size, right? We have two different sample sizes in general, the nominal sample size and the effective sample size. The nominal sample size is just the raw sample size that is not accounted for by other things. You know, this formula does not account for issues like response rates and all other things, right? So the number you get here is adjusted for everything. And that's what this hint is telling you here. This hint is telling you that the displayed sample size accounts for additional factors beyond the base formula, which is here. This may include the finite population correction, the design effect, and many others. So the idea is that you don't have to start worrying about, oh, do I have to adjust for so and so? No, you don't have to adjust for anything. Once you get this number, you can proceed to use it, because all the adjustments have been made in the background. And so this is just to let you know that the nominal sample size is quite different from what you expect from the effective sample size. So this number represents the effective sample size, which means we take the nominal sample size and then we adjust for everything that needs to be adjusted. And then we give you the number. So you don't have to worry about the math. The platform does that automatically for you. So that's how you account for sample size with complex surveys. You have to worry about the clusters and the strata. So remember, complex surveys, we always worry about two things: clusters and strata. Those two things are always at the top of our mind. So this is worrying about clusters. Design effect worries about the clusters here. And this is worrying about strata. And remember that we worry about those two things in the context of NCHS guidelines. So NCHS guidelines tells us that, well, when you are selecting your strata, you want to have at least, your clusters, you want to have at least eight clusters. You want to make sure that your confidence intervals are not more than 30 percentage points wide, right? So all of these things guide how, what parameters are allowed in here. And the platform already puts validations for all of those things so that it prevents you from making a mistake. So even if you are going to make a mistake, it will tell you, no, we will not allow this, not on our watch, so that you can be assured of the values you have. Now, when we now we know that we need to sample 2,305 people. The next question is, how do we sample them with cluster sampling? That takes us to this part of the platform here, where we'll go to sampling. And let's start new sampling. So remember we said that cluster sampling can be either same probability or different probability, depending on what we design it as, depending on the design. Everything always boils down to the design. How did you design it? So by default, the platform uses a same or equal probability selection in cluster sampling, and that's to make your life easy. This is a very, very common procedure with CDC and WHO because it's very, very easy to implement in the field. So I will quickly demonstrate the two-stage PPS and explain how it works so that we can understand it conceptually at least. So here, we want to automatically draw a representative sample. And what happens here is that the platform has pooled data sets from different countries around the world, from their census or their, Federal Bureau of Statistics or Census Bureau, or whichever agency exists in that country. So when you are drawing automatic samples, it is based on official data from each country. So let's say we want to draw a representative sample for the United States. So select that. Here, we can select the state, or if we want our sample to be representative of a state. But if we want to be representative of the entire country, we can leave these fields blank. So I'm going to leave this blank because our goal here is to select a representative sample at a national level. Now, next, select the number of clusters you can reach your sample from. Now, this is important to note again that going back to NCHS guidelines, the minimum number of clusters we want to select is 8, right? And the Chisquares platform uses the second administrative units as clusters because we want to be as close to the ground as possible. The second administrative units are counties or county equivalents. So in the US, that we have national level, and then we have states as the first administrative units, and then we have counties under states as second administrative units. Nigeria, we have states also as the first administrative units, and then we have local government areas as second administrative units. So the platform consistently uses counties or county equivalents, or in general, the second admin units as clusters, so that we keep it as close to the ground as possible. So here you select the number of clusters you want. Make sure you don't put a number less than 8, right? Higher numbers are great because it allows for estimates that are very precise. So here I can say, okay, I want to select 30 clusters. And then my sample size. We calculate sample size of 2,500 and I cannot remember, but I'm going to say 2,544. And then we can click on Get Sample. So what happens now is the platform has drawn a representative sample for the entire United States. So first of all, let's look at the map to see what it looks like. Okay, let me go select coordinates. If we want to visualize that, we have to ensure that we pull in the longitude and latitudes. But for now, let's just focus on the raw data and explain the mechanism of what's happening behind the scenes. So first of all, note that there are 2 stages of selection, right? This method of sampling is called a 2-stage PPS. And there's a link here to a WHO paper. Let me drop that in the link for those of you also who might want to read more on it, on the methodology. A 2-stage PPS means that obviously it's a 2-stage procedure. How do I drop the link here? Okay. So for those of us who want to understand, this is a white paper by WHO that goes into quite interesting depths on 2-stage PPS. So in the first stage of a 2-stage PPS, we select number of clusters proportional to size, right? So in this case, we want to select a random sample of the entire United States. So with the sample size of 2,300 or whatever the number was, it knows that, okay, and with 30 clusters as what we wanted to select, it randomly draws clusters from the United States. The US has approximately over 3,000 clusters. And so the clusters that are selected, or counties in this case, are drawn such that the bigger counties have a higher probability of being selected than the smaller ones, right? So let's take a look, for example, if you look at, Sacramento here, for example, in California, this is the population here. You can see that the probability of selection of this cluster is 0.1435. This is a larger probability, right? But when you look at this other one here, Newton in Arkansas, this population is just 7,225. The probability of selection of this cluster is much smaller. So in a two-stage PPS, the first stage of selection means that the larger clusters are more likely to be selected than the smaller clusters. So that's what you have here as a cluster probability. Now, the magic of a two-stage PPS occurs in the second stage. In the second stage, we must select the exact same number of people from all the clusters we have selected in the first stage. So that's why you see here, number sampled, 85, 85, 85, exact same number. If you want to have a self-weighting two-stage PPS, this must be done, right? So now that we selected a fixed number of individuals from each cluster, it means that the smaller clusters have a higher probability of being selected because they are few and we're selecting a fixed number of people, right? So that means that the numerator is constant in all selections. So that means that clusters that are smaller have higher probability in the second stage. So you see here, here in Sacramento here, suddenly its probability is very small here, as opposed to Newton, where the probability is now much larger, right? This was the reverse. So that's the magic, that's the statistical beauty of a two-stage PPS. So that in the first stage, the larger clusters are favored. In the second stage, the smaller clusters are favored, and that counterbalances each other. And you now have an equal probability for every single person at the end. So the joint probability, which is simply equal to the probability of individual selection times the probability of cluster selection, will give you an exact same number for every individual, right? So this is one of the few instances where a multiple stage cluster selection will result in a self-weighting sample. It's because of the beauty and the simplicity of this methodology that it's very commonly used in the field. Because once you implement the two-stage PPS, you don't have to worry about weights or about, all of that correction is not needed because the sample itself is self-weighting. All right, we're going to stop here today and take questions. But again, remember, next week we're going to start on this methodology, and we'll just dissect the whole design of NYTS so that it brings into focus all of the different things that we've covered, so that we can then connect the dots together. Okay, at this point, I'm going to open up to questions and take questions that folks might have. Yeah, I see some people are saying they don't have the links to the case study. I'm not sure why they, all right, I'm going to drop it again. Oh, I see. I think I see what's happening here. It's been saved on my local storage. Let me just share the link to, I'm not sure why it's saving on my machine locally. All right, please use the www.cdc.gov and then access the materials from this page. All right, is Lungile still here? Okay, okay, I'll just call the folks. Daniel Owusulu. Are you able to unmute yourself? Okay. Are you guys able to unmute yourself? I think you can. I believe so. All right. Abate Jolly. Oh, you can't. Do we have Lungley here? Okay, let me see if I can unmute you. Hold on a minute. Ask all to unmute. All right.
Hello, Prof.
All right, please. I have unmuted everybody, so we need to practice some good tech hygiene. Can we please unmute ourselves if we're not speaking, please? Okay. Please mute yourselves if you're not speaking. All right. About Jolie, can you ask a question, please?
Well, thank you very much for another wonderful and interesting session tonight. I want to ask these questions. The first one is about the design effects. Is it just limited to just cluster sampling techniques? I think I overheard you, but I wasn't quite sure. Say we could also use design effect when you are doing random sampling and use the value of 1. So
can we please mute ourselves if we're not speaking? Okay.
Can you hear me?
Hold on a minute. Let me.
I don't know if you can make me co-host, so I will.
Okay. Great. All right, great. Let me make you that. I'll do that. Yeah, great. Let me do that. Ilya, that's you, right?
Yes, sir.
Okay, alrighty. All right, I've made you co-host.
All right, thank you. I'll now mute everyone and unmute people when they need to speak. So Prof, you can unmute, then I'll unmute people as they raise their hands.
All right, I'm unmuted.
Right,
so let me answer about Jolly's question. So the question is if the design effect is in relation to clusters, why did we mention why are we dragging in simple random sample into it, which is obviously has nothing to do with clusters? That's an excellent question. So remember that everything we do is always done with simple random sample as the benchmark. If from a philosophical perspective, if we're to say which sampling technique is the most important, philosophically, the answer will be simple random sample. Because simple random sample is a benchmark against which we assess the performance of all the other sampling techniques, right? That is why simple random sample is king. Even though we cannot use it practically in the field, it still remains king. So when we say somebody is fast or slow, there has to be a benchmark, right, against which we're comparing their speed. The same thing happens with design effect. When we say that there is a lot of variance or there's little variance, the question is, against what are we comparing it to? The answer is against simple random sample. So that's why simple random sample is so important in survey design, because it forms the benchmark against which we compare everything. So when we say that the design effect tells us the degree of, variance we'll have expected, we're comparing it in a cluster sample versus what we would have seen had we used a simple random sample. So that I think that's the clarification we need to make clear. But to also add some more nuance, the design effect does not only appear in surveys. It appears in any context where you're using cluster sampling, period. Full stop. So you can think of course, it's going to appear in complex surveys, but it might also appear in randomized trials where we're randomizing at the level of groups, not at the level of individuals. So we have cluster randomized trials where we're randomizing based on clusters, not individuals. Allocation is based on clusters and not individuals. So there again, you will expect that you have to account for cluster selection because it's one and the same thing, but just appearing in different contexts. So I hope that clarifies. All right, next question, please.
Thank you, Prof. I've dropped the attendance in the chat. Do well to complete it before leaving. Faraja, you can unmute and ask your question. Faraja Muri, you can
Yes.
unmute now.
Hello, Prof. Can you hear me?
Yes, we can hear clearly, yes.
Yes.
Yes. Thank you for this brilliant presentation once again. So I want to know whether for this kind of service, is it possible to change the framing of the survey from time one to time two for this like for surveillance survey system or longitudinal? If I want to know whether is there something that can make the assessor to change the framing of the survey from the time one survey to the time two survey. I want to know, and what can be the impact on the outcome of the survey once we need to interpret the results for the time two or time three according to the frame. Can we change the framing from time one to time two? And if so, what can be the reason for this change? I want to know this, Prof.
Okay, that's a good question. Now, the word framing as you used it is very generalized. So allow me to narrow it down a bit to, can we change the methodology, right? So that we're more specific in what we are answering. So the question I'm answering therefore is it allowed to have methodologic changes from T1 to T2 in a surveillance system? Now, the answer is you really want to avoid it because the whole point of creating a surveillance system is to track changes over time, right? And so once you change the methodology, and changing methodology could be anything. It could be the framing of a question, the way you ask the question changed, or you added a response option, or like in BRFSS, historically we used to do BRFSS as landline surveys. And then in 2011, I believe we added cell phones, right? All of those things are methodologic changes. And the impact is that you are no longer able to compare results with the past. So if we implemented, let's say, a new way of collecting data or a new question or a new sampling methodology, we simply cannot compare results from that period versus the past. So you want to be really careful. It's not just something you wake up and say, oh, let's try a new methodology today. No. That's bad practice. And that's why I showed you earlier the indicators with which we evaluate the surveillance system. And one of the most important is, stability. A good surveillance system must be stable, which means that year in, year out, it is just boring. Boring is a good thing. We need surveillance system to be boring and measure the same thing over and over and over. And if you really want to have some flexibility, then you can add some rotating questions that can change from year to year, but the core questions are stable year in, year out. Otherwise, you won't be able to measure trends over time. All right, next question, please.
Thank you, Prof. Onwusulu, you can unmute. Onwusulu Daniel. You can unmute, please. Okay, let's move to Anthony.
Okay, thank you very much, Prof, for your nice presentation and these important topics. I will have I will have one question. Just, is there any limitations in the number of clusters if we are interested to conduct a cluster randomized control trial?
No, so if you want to conduct a cluster randomized trial, obviously the rate limiting step will be number of, it depends on what the cluster is. But the obvious rate limiting step is how many clusters do you even have in the first place, right? So that will be the hard limit. So how many you can have. Sorry, your question was incomplete.
Yes, Prof. Yes, Prof. Such, for example, if I am interested to conduct a cluster randomized control trials in the hospitals, and if I am interested to make a clusters among the hospitals or among the health centers, at least how many hospitals or health centers require to make a cluster here?
It will depend on the size of the population inside the cluster. Because remember that you're interested not necessarily in the clusters, but the people inside the clusters. So now your outcome of interest will determine that evaluation too. You might be interested in, let's say, oral cancer, right? Now, the hospital size itself might be 10,000 patients, but the number of oral cancer patients is just 5. So it's very hard to answer that question without knowing all those parameters. But bottom line is that you want to look at the size of a cluster. And by the size, I don't mean the size of everybody in that cluster. I mean the size of the outcome of interest. In this case, if you're interested in oral cancer, then you're looking at the size, number of patients with that condition. That is the effective size, not necessarily everybody who is there. So it is impossible to give a straightforward answer without knowing all of those. It's one of those things that is driven by context as opposed to some black and white answer. Okay, next question, please.
Yeah, Prof.
Thank you, Prof.
This is Anthony.
Okay, yeah,
Can
Anthony,
you hear me?
go ahead, yes.
Okay, just quickly, if you can hear me. I want to ask about strata. If I'm doing a survey and I'm supposed to stratify by age ranges and then by sex. So the age ranges I'm talking about maybe 12 to 18, 19 to 30, 30 to 40. So I have about 5 age ranges. And I'm also supposed to also stratify by male and female on each of these age ranges. What would I consider the number of stratas for this my study?
Okay, so you said let's solve it together, so that we don't just talk about it in theory. So you have age. How many groups do you have for age?
5.
So age got 5 groups.
Yes.
And you said gender. You have how many groups?
2 groups, male and female.
Okay, is that all the variables you want?
So let's add habitation, rural and urban.
Okay, so let's call this residents 2 groups. All right. Now, how many groups, how many strata do you think you have?
So if you ask me, I would say there should be 5 times 2 times 2. That's about 20.
That's correct. So that's the number of strata that you have. You're absolutely right. And now see the danger here, right? Your sample size has effectively been increased by a factor of 20. And you have to think about the research or survey design is not just about science. It's also about logistics and costs. There's no free lunch, right? If you are, imagine you have to pay incentives and you had a budget of just $100. Now that sample size has been increased by a factor of 20. So everything is increasing by 20. The budget has to increase by 20. That becomes very complicated. And so this is the danger of having too many strata. The variables that you're going to stratify on should be highly correlated with the outcome. And this is one scenario where less is more. Remember that stratification does not add validity, all right? It's a luxury. So you want to really cut that luxury to a minimum so that it's still affordable, and the study can still be done. Does that answer your question?
Yes, thank you so much. It makes it clear. But I do have another on cluster. Again, I'm asking from a point of view of a study that I'm engaged in at the moment. So the study is in Nigeria, and actually I'm trying to choose a state, one state per geographical zone. So in Nigeria, we have 6 geographical zones, and I'm trying to choose a state from each zone, and then probably, again, it's also related to COVID, those who took COVID tests. So in each of these states, I want to look at the COVID data and sample people from each of those states that did a COVID test for my survey. So in this scenario, what will I be looking at as the number of clusters?
Okay. What do you think?
Yeah, this is where it's a bit confusing for me, because if I was sure, I wouldn't have asked. I'm a little lost on this. I would say that I have 6 clusters, but my challenge now is what you have just said, that it has to be 8. And if I do have 6, and these clusters are done based on geographical area, which actually introduces the best form of variability in terms of the data, I don't know how I could get 8 clusters from the country.
Okay. Remember that the fundamental principle in selecting clusters is that we said they have to be very close to the ground, remember?
Yes.
So selection of states violates that principle because states are not close to the ground at all. They are very high above the ground, right? So in your study here, I think we even have a slide on this. Hold on a minute. This is a slide that is exactly relevant to your case. Example, you want to survey adults in Western Nigeria. Of the 6 states in the region, you want to select 2 as clusters. Specifically, you choose Lagos and Oyo for convenience. However, the fact that you selected Lagos and Oyo because they were close to you automatically means that that is the non-probability sample. Your study is the non-random selection. So a better thing for you to have to do is to say, I am going to select, okay, let's go back to the PICO, so that we can think about it from first principles, right? Now, which of these 4 elements of PICO, which of them do you think doesn't have to be random? In fact, which of them must not be random, but must be very intentional in how we select them? Which one do you think?
I think it's basically the population.
Exactly. Population cannot be random. I mean, there's a reason why you choose to say, I'm going to study this population. It is not a random event. It's a well-intentional event, right? We sit down and say, oh, for whatever reason, whether it is because it's my home or because there's disease there, we choose populations for sentimental reasons or for subjective reasons, and that's fine. Now, so a better design for you to say will be to say, I am going to select as my population. Remember, the population is how you first define the large, you put your arms around the whole population and say, okay, this is my entire population. It would be better for you to say, I am going to select these 6 states as the population of interest. So that is not a random selection, it's defined intentionally. Now, you now have 6 states that make up your population, and then within those 6 states, you might have like maybe 200 local government areas. You can then select the local government areas as clusters. So you can say, okay, of these 6 states, I'm going to select maybe 30 or 30 local government areas as clusters. And then you go from there. So that is how I would do it. So that way, your population is defined intentionally, but your clusters meet minimum standards for precision according to NCHS guidelines, and you select clusters in a way that is close to the ground. Does that make sense?
Yeah, it does. Again, looking at it from the point of view of what my population is, my population is actually those who did COVID tests in Nigeria. So I might reevaluate based on what you said as to local governments. But again, the whole idea of choosing the initial 6 states was just to make sure that I capture enough people. Again, I was also thinking about responsiveness, because it's also going to be a web-based survey. But let me take the information you've given me back and think through it. I think it will help me solve some of the problems. So thank you so much. Let me just think through it. If there's any need, I will talk about it in the next class. Thank you.
Excellent. That sounds like a good plan. All right, next question, please.
Thank you, Paul. Gideon Kelvin. Gideon, can you unmute?
Yes, can you hear me?
Yes.
Yes, I can hear clearly.
Okay, thank you. Thank you very much for the class. So I have 2 questions. First, I'm just curious. We mentioned from the beginning about issues around cross-sectional surveys, and then in terms of survey, and then repeated survey and longitudinal for surveillance systems. So I'm just curious, is there anything like repeated cross-sectional survey? And then secondly, we also spoke about stratification and clustering, and I know you mentioned that stratification is a matter of luxury, but I'm trying to look at, in terms of credibility of evidence, will we say that evidences from stratified sampling are more, in terms of representativeness, are more accurate compared to evidence from cluster sampling? Thank you.
Thank you. Good question. So, all right. So let's ask the first question was, can there be such a thing as a repeated cross-sectional study? Let's go back to the the NYTS data set. So this is NYTS. This is the years in which it was conducted from 1999 onwards. Every single year, we go take a random sample of students in the US, generate results, right? Every single year. So each year is a cross-sectional study, but it's repeated. And it's repeated, that's why we can look at trends over time, right? So if you just Google trends, NYTS, let's go at this. You can look at, let's look at tobacco, sorry. All right, so when you look at NYTS, you can see results that look at, okay, each year we look at each sample, right? This is, okay, that's not a trend per se. But the bottom line is that, you can take a bunch of years from NYTS. Okay, good. This is from 2011 to 2023. Each year you can look at, oh, this was the prevalence in this year across time, right? So yes, you can have a repeated cross-sectional survey. And this is a clear example of this. Each particular year is a cross-sectional study, but we are repeating the survey with the exact same methodology every single year, right? If the methodology changes, we cannot compare. If we have a change in methodology, we cannot compare anymore. So we repeat the same methodology every year, year in, year out. That gives us a snapshot, not of an individual, but of the country overall, so that we can say, oh, wow, we can see that overall this smoking prevalence among youth is going up and down. So that's that. So yes, you can have a repeated cross-sectional study, which is we survey the population using the same methodology over a long period of time. Now, the question about, can we say that one methodology that uses stratified sampling is more valid? Because you use the term more representative, but representative in this case means external validity. And remember that we said that we don't use stratified sampling to improve validity. We use it to improve precision or efficiency of estimates. So no, we can't say that results from a stratified sampling or sample are more valid than those of a, let's say a cluster sample that does not use stratification. We can't say that because we don't stratify to improve validity. We stratify to improve efficiency, right? What we can say, however, is that a stratified sample allows us to now talk about issues of smaller subgroups to a larger extent than we would if we had used a cluster sample that does not use stratification, right? So validity is essentially saying overall, can we say that the results from this sample are generalizable to the overall population? Whether it's stratified or not stratified, that does not affect validity, right? Now, where it matters is now, when we now dive into that sample, can we now look and say, oh, this small group here you are. Can we talk about your issues to a greater extent? Yes. In that case, stratification allows us to dive into that sample and then discuss the issues of that smaller subgroup more eloquently because we have a larger sample for them. Does that distinction, do you understand the distinction? All right, next question, please.
Thank you, Prof. Owutulu Daniel. Owutulu, can you unmute?
Thank you very much, Prof, for once more interesting session. Prof, I have a question with regards to the width of confidence interval. All along the examples we've had are for maybe categorical variables in the confidence interval. What of when we have continuous or quantitative variables? The 30%, how do we get the 30%? How do we get it now? The difference. That's the margin error of.
So there are several precision rules that we can use. So yes, you're right that these ones are more popular for calculate for when we talk about proportions. But for means too, we have a whole range of ways to assess the precision of estimates. A very common method we use is the relative standard error. So you take the standard error of the mean and you divide it by the mean and multiply by 100. And generally, we accept relative standard errors of larger than 30% as being imprecise, which is along the same philosophy as what we just discussed for categorical variables as well.
Okay. Thank you, Prof.
You're welcome.
Dr. Abdullahi. You can unmute. Dr. Abdullahi Amadou.
Hello, good evening, Prof. Am I
Hello.
audible?
Very, very well, yes.
Thank you so much for this insightful lecture. I just have two questions. The first one is regarding the precision, the margin of error you mentioned earlier. Is it the same thing as the precision? I know you gave us a lecture on precision and validity, and you made mention of the width of the confidence intervals as a marker of how precise our values are. So what I'm asking here is that the margin of error and the precision, what is the relationship between the two of them? And then I know you mentioned something about absolute and relative margin of error by NCHS. So I'm not quite clear which one is the 30%. Is it the absolute or the relative? And how do we arrive at that percentage?
Okay. So I think you already answered the question very eloquently. You used the phrase a marker of precision. That phrase used by you already captures it very well. So all of those things are markers of precision. There are many of them. I mean, so whether it's this, whether it's confidence interval or the margin of error or standard error or whatever you're using, right? They're all singing the same song. They're saying, oh, you are precise or you're not precise. So it's a marker of precision. The second question, yes, it's the absolute measure. And please, it will be very great for you guys to read the complete NCHS report. So I think it's very solid reading material for anyone who is interested in methodology. So, but yeah, that's the absolute measure, and we get the 30% by subtracting the upper bound from the lower bound.
Okay, so when you say 30%, for example, if I have an interval of a variable, let's say the limits are, let's say 1.5 to 6.5. I mean, how do I get that 30% in this case? Do I take this difference and divide by the lower one, or how do I arrive at the 30%? That's what I'm not clear about.
So you take the 6.5.
Yes.
In this case, 6.5 minus
Yes.
1.5 is what?
That will be 5.
5. So now you compare it to the 30% benchmark, and you are saying, is 5% bigger than 30%? The answer is no, right? So you can say, oh, okay, based on NCHS standards, my estimate is precise.
Okay, so whatever I get as a difference, I directly express as a percentage directly.
Excellent. Yes.
Okay. Thank you very much.
You're welcome. Yeah. NCHS expresses things in proportion. So if you're reading and you are it might not be very clear to you when they say 0.3, is obviously expressing as a proportion, but so they assume that you should be able to easily convert between proportions and percentages. But yeah, that's a bit of a trivial point, but just to make sure we're not confused on that.
Okay.
All right, next question, please.
Thank you so much, Prof.
You're welcome. Yeah.
Thank you, Prof. Detalem. Kindly unmute Detalem.
Okay. Good evening, Prof. I really appreciate the presentation, and I really engage it with the whole content. I have 2 questions. The first question is, during selecting of the cluster sampling, we said before that we can use a minimum sample of 8. Is there any rule? Is there any percentage? For example, 10% of the total cluster sampling or 1.5. Is there any rule? If so, the second question is, in the practical research on the ground during the retrospective cross-sectional study using the secondary data analysis, using sample survey or census, which one is very feasible and representative enough in case of analysis of secondary data using retrospective cross-sectional study? Thanks. I really appreciate the presentation and the whole content.
Yeah, thank you. Okay, I probably forgot your question, but I just remembered now. So the first question was, is there a rule of thumb that we can apply to say, well, if you have X number of clusters, just take X% of them and you're fine. So if you have, for example, 100 clusters, then take X number of them. Such rules of thumb can be a bit dangerous because somebody might have 10 clusters and say, oh, I was told to take 10% of them, and so I'm going to take 1. See how we easily go into very dangerous territory with imposing arbitrary rules of thumb, right? But in general, so that I can answer your question directly, in general, you find that in large surveys, what we typically do is that where we have like thousands of clusters, we typically sample between 2 to 5%. Like 5% is actually a lot, but it hovers between 2 to 3% of available clusters. Let me give an example. In the US, for example, we have over 3,000 clusters. The number of clusters we select for most national surveys would be around 200 of those clusters. And we don't really call them clusters when we're sampling them, because they're not true clusters, because some clusters are very big, some counties may be very big, so we have to chop them into pieces. And some counties may be very small, so we have to put them together. Because if a county is so big that the probability of selection of that county is 1, then it's no longer probabilistic. That's a problem for us. And if a county is so small that its probability of selection is almost approaching 0, then it's no longer probabilistic also. So that's why when you're reading reports, you won't see the word counties, because we have done some treatment to them to either break them apart or put them together. But in general, right, that even if we assume, let's say 3,000 counties in the US, and we selected 200, you can see that that's still a very small percentage. But that's how we conduct national surveys. So there's no fixed percentage per se. It's really an issue of logistics. Remember that the number of clusters doesn't have anything to do with validity. It has everything to do with precision, right? So the question is, how much money do you have? Like, how much resources do you have that will support? As far as you're selecting beyond the minimum number that is stipulated by the NCHS guidelines, the remainder is really a function of how much resources you have in terms of time and money, right? And if you really, really want a percentage, I would say if you have a very large number of clusters, then you should aim between 2 to 5%. But please take that with a big pinch of salt, because it's all contextual. It depends on your resources and all of that. But again, context is key here. Now, your second question about if between a cross-sectional survey and a census, which is better? Well, that's not exactly how you asked it, but I'm just simplifying the question. In general, we really want to stay away from, comparisons like that, because they don't really matter. A census is a census. We will rarely do a census. There's really no need for us to do a census, because we can easily take a sample and get a valid estimate as long as that sample was at random. So saying that, oh, well, I can take a sample, but I want to go ahead and take a full census, that's a bit wasteful in terms of resources. Now, if we already have existing data, if there were existing data and we're using them, that's a different issue, right? But we just need to know that, okay, if we're using census data, we need to be mindful of certain things, right? Like, it would be very ridiculous for you to use census data and be putting confidence intervals. That would be quite funny, right? So you should know best practices when you're handling census data versus when you're using data from samples, because obviously each of them has their own, statistical underpinnings for how we would calculate things and what would be valid or what would be precise. So I hope that's clear. So bottom line, let's not pit one design over the other, because they all have their own use cases. All right, next question, please.
Thank you, Prof. Pius, can unmute.
Thank you very much, Prof, for your lecture.
Thank you.
Please, I have a question regards to something that somebody asked me. For example, if you want to carry out a study in an entire state, let's just say Plateau State, for example, in Nigeria, and you calculate the sample size using previous studies, and you say, for example, you get 250. But somehow within us, we feel that this 250 is not good enough for an entire state. This is not a study that will be done in an area in the town or in the capital. So when the person asked me, I said, well, for me, what I usually do in that case is to say 250 will be per local government. Since we have senatorial districts, usually 3. So, okay, maybe choose 2 local governments per senatorial district, and the 250 will be per local government. So I know you mentioned that research is both a science and an art. So please, I want you to say something about this. What is your advice? And finally, my second statement is a comment that when people want to write PhDs or go for their fellowship exams at postgraduate medical colleges here, there are times you will write something in your methodology and they say, where's your source? And sometimes when we hear you speak, you say so many things that clarifies a lot of misconceptions or things that people have been grappling with. But some of these things, we can't find them in articles or books. It's difficult to locate. So I think it would be good if you consider putting all this, your knowledge, in paper form or in a book form. Maybe you write a research methodology textbook. It will go a long way to make life easier for us researchers. Thank you very much.
All right, thanks. So regarding your first question, what you are effectively doing is you are stratifying. You are saying, okay, I'm going to stratify by, I can't remember the term you used, whether, geo zones or, essentially you said you have 3 zones of that nature in the state. So you're going to stratify. So what you're doing is you're stratifying, you're using a stratified cluster sample where you first of all stratified into the 3, and then you then sampled within each stratum. So it's fine. Again, survey design is a science and an art, right? Now, the only thing, however, is that what we require is that after you have done it, you must be able to use the proper terminology to tell us what you did, right? So in that case, what we'll then expect is for you to tell us that you use a stratified cluster sample, right? Where you, first of all, stratified based on so and so, and then you did that. Now, the only thing I would advise is that when you're stratifying, the variable you're stratifying on must be highly correlated with the outcome. Remember, we said when we're discussing systematic sampling, we established a principle that when you are sorting your sampling frame, the variable you are sorting on must be highly correlated with the outcome. The same thing applies with strata. So the question I would then ask is there any indication that this geozone variable that you are stratifying on is correlated with the outcome? If it's not correlated with the outcome, then the question is, why then are you stratifying on it? So as long as you can make an argument that yes, for these reasons, there is reason to believe that the variable used for stratification is correlated with the outcome, well, that's fine. But that's something we want to pay attention. So it's not just stratifying on anything, it's stratifying on variables that are highly correlated with the outcome. And yes, book, it's one of those things I've always wanted to do, but I never ever have time for writing. So, but yeah, it's something I will do down the line. Thanks. Next question, please.
Thank you, Prof. Yeah, true. I saw one in the chat. Let me read it. 65% of all available clusters or 8 clusters. Under what conditions do this apply?
Sorry, can you repeat that question again?
2 to 5% of all available clusters or 8 clusters. Under what conditions do this apply?
No, the original person who asked the question was looking for a number, and I preceded that by saying, please, let's avoid arbitrary rules of thumbs, because the only rule of thumb is that there's no rule of thumb. The danger with giving any number, no matter even if it's in a list, the list, prescriptive manner is that sometimes we just take those numbers and say, oh, and then apply them arbitrarily in all contexts. The most important thing is, so what we're going to do is that let's just completely erase that number from our minds, right? And let us remember, let's put in our minds that context is king. So what we're going to select, the number of clusters we're going to select is going to be a function of our context. The context should determine what we do. We're scientists. We're not just following some arbitrary rules. So as scientists, we are knowledgeable enough to make judgment calls about our population and say, okay, here I have 10 clusters or 10 local governments. So obviously, selecting 2% makes no sense. So in this case, I have to select all the clusters, right? Or in this case, I have 1,000 clusters. I can select 2%. That will still give me a fairly large number of clusters to ensure precise estimates. So more than any number, like 2% or 5%, is context. I cannot emphasize that enough. So context is king. All right, next question, please.
Thank you, Prof. I think we've exhausted the question.
All right, awesome.
There's no hand, there's no any question in the chat.
All right, awesome. All right, thanks everyone. Again, please make sure you review the homework for next week. The homework is simple, right? Just review the NYTS methodology in great detail because it's of sufficient. It's not overly complex. And it's not too easy. It's just the right amount of complexity to use as a case study in our class for next week. And so jot down all your questions. I'm going to post some things that I would like you to pay attention to when you're reviewing so that you can pay close attention to those things, and then we can discuss them in next week's class. All right, thanks everyone, and have a great weekend.
Thank you, Prof.
You're welcome. Yeah, bye.
Thanks everyone for being part of this presentation. Please, if you are yet to complete the attendance, try and do that before you leave. That counts for your certificate at the end of the webinar. You would need to have at least 2 attendance to get certificates to ensure you complete the attendance for today. Thank you. Hi, Ben. Good to see you on camera. Okay, I think I've unmuted everyone. Mr. Ben?
Unmuted. I'm saying I'm joining Dr. Ben just to say hello, joining him in this Rex business.
Thank you, Langile. Yes.
Thanks, Leah. Great job
the
as
cat is away
always.
now. The rat can run around.
Hello,
The
Albert.
usual.
Dr. Ben.
Yes.
Dr. Ben, good evening.
Evening, Taiwo.
Good evening. I'm fine. And you? How is Malaysia?
No problem.
All right, sir.
Yeah.
We really enjoyed the lecture. It's really complex in nature.
Yeah.
It's a complex it's complex in nature, but
we'll be eating it gradually and we'll get it done.
Sure.
Yes.
So how is everything, sir?
Very fine, no problem.
Yes, sir.
Yeah. Thank you so
Mr.
much.
Michael, yeah, thanks for the other day. I was able to get the certificate in my spam, the spam message. I was able to get that.
Yes, we can't emphasize that enough. Whenever we share certificates, it's always good to check your spam. Most times the emails are directed to your spam, so you will need to check that before you send out a complaint or drop a message in any of our groups to inquire about certificates. Thank you for that feedback.
I'm sorry about that. That is
No,
noted.
it's fine. It's fine.
Oh.
Thank you for the feedback.
You're welcome.
Anyone having issues with completing the attendance?
Let me see.